Research shows that smoking cigarettes causes the brain to shrink. It has long been known that smoking cigarettes is seriously harmful to health, primarily the lungs and heart. But according to new research, it also affects the brain. As American scientists have found, smoking can lead to brain shrinkage. Research conducted by scientists from Washington University School of Medicine in St. Louis showed that smoking cigarettes leads to brain shrinkage. According to them, quitting the addiction prevents further loss of brain tissue, but does not restore the brain to its original size. The results and description of the research were published in the journal, Biological Psychiatry Global Open Science. The human brain loses volume with age, and smoking cigarettes only worsens the problem and causes premature aging. New research helps explain why smokers are at high risk of age-related cognitive decline and Alzheimer's disease. Although it has long been known that smoking cigarettes harms the heart and lungs, its effect on the brain has not been thoroughly studied so far. This gap was filled by American scientists. Until recently, the effects of smoking on the brain were often overlooked, in part because we focused on all the terrible effects smoking has on the lungs and heart. But when we started taking a closer look at the brain, it became clear that smoking was also very harmful to the brain, said Professor Laura J. Bierut, co-author of the study. As part of the study, scientists took into account various factors, such as a genetic predisposition to smoking and the brain volume of smokers. Both brain size and smoking behavior are heritable. Scientists say that about half of tobacco smoking can be attributed to genes. Bierut and her colleagues used data collected in the British Biobank, a publicly available biomedical database containing genetic, health and behavioral information about 500,000 people, mostly of European descent. This database contains brain imaging records of over 40,000 people that can be used to determine brain volume. There is also data on cigarette smoking. In total, the team analyzed data on brain volume, smoking history and genetic risk of starting smoking for 32,094 people. The researchers also took into account the period of smoking and the amount of cigarettes smoked. Their brain scans were then compared with those of people who had never smoked. Analyses have shown that smoking is a significant factor in brain shrinkage. Moreover, the relationship between smoking and brain volume was dose-dependent. The more a person smoked per day, the smaller his brain volume was. It sounds bad and it is bad. The reduction in brain volume is consistent with increased aging. This is important in the face of our aging society, because both aging and smoking are risk factors for dementia, admitted Bierut. By analyzing data from people who had quit smoking many years earlier, scientists found that their brains remained smaller compared to people who had never smoked. You can't undo the damage that has already been done, but you can avoid causing more damage, said Yunhu Chang, first author of the paper. Dr. Bierut noticed that smoking releases dozens of toxic chemicals into the body. Moreover, smokers have chronically lower levels of oxygen in their blood, and the oxygen-loving brain is starved with chronically lower oxygen levels, she added, while emphasizing that it is never too late to quit smoking. old age in childhood, or progeria. Fortunately, this disease rarely develops, and it is difficult to imagine old age, which begins already in the second year of life. However, people affected by progeria experience exactly this and die at the average age of 13. There is no therapy to treat this rare genetic disease yet, although new discoveries give hope. A single mutation in the genome is enough for the human body to start aging shortly after birth due to the destabilization of cell nuclei. This is the manifestation of progeria, more professionally called Hutchinson-Gilford progeria syndrome, after the names of the English doctors who identified this disease at the end of the 19th century. The mentioned mutation is not inherited from the parents, but appears as a new damage to the genome in the developing zygote, sperm or egg cell. Fortunately, it is extremely rare. According to the Progeria Research Foundation, progeria affects 1 in 8 million newborns. For comparison, in the case of cystic fibrosis, approximately 1 in 5,000 newborns has it, and 1 in 18–20 million living people suffer from it. However, when it does happen, the current state of medicine leaves the patient with few chances. In the most optimistic scenario, some people live to be 20 years old, and the average life expectancy is only 13 to 14 years. Most often, sick people die from strokes or heart attacks because, despite their biologically young age, their body is already old. Symptoms usually appear within the first year of birth. Despite normal intellectual and motor development, the child begins to grow much slower. Over time, typical appearance changes appear. The face narrows, the jaws become smaller. The head and eyes become disproportionately large compared to the face. The shape of the eyelids changes. Hair loss occurs, including eyebrows and eyelashes. The skin all over the body becomes thin and wrinkled with visible vessels. The voice becomes unnaturally high. Unfortunately, the changes visible at first glance are not all the effects of the genetic mutation. Serious changes also take place inside the body. Severe atherosclerosis begins to develop. The development of bones and teeth may be impaired, joints become stiff, hips may become dislocated, hearing is often damaged, due to disruption of sound conduction to the inner ear. The amount of fat under the skin and muscle mass decreases, develop insulin resistance may occur. The disease can usually be diagnosed during routine examinations. In addition to typical visible changes, the diagnosis helps, among others, hearing and vision tests, measurements of the child's height and weight. However, because the disease is extremely rare, experts recommend reporting any concerns to your doctor. This is good advice in any situation. A DNA test may also help. Unfortunately, there is no therapy that could cure someone from progeria or significantly change the fate of the patient. However, doctors can, first, help alleviate the symptoms of damage. Drugs that reduce the risk of heart attacks and strokes, including small doses of aspirin, anticoagulants, lower cholesterol, reduce blood pressure, and limit headaches and convulsions are often prescribed. Rehabilitation helps keep joints functional longer. Nutrition and dental care are also important. Secondly, the first drug, still under investigation, directed strictly against progeria, called lonafarnib, has recently become available. which gives a chance to prolong life. Although still not enough for the patient to live to adulthood. 2 years ago, in the magazine, Nature, researchers from Harvard University and many other well-known scientific centers described a method by which they significantly extended the life of mice with progeria. Using a new genetic engineering technique they developed, scientists repaired the mutation in the rodents shortly after they were born. Gene therapy in the form of a single injection repaired the damaged gene in a large number of cells in various parts of the bodies of small mice, including in the heart and aorta. Many of them still contained repaired versions of the gene after 6 months. The results positively surprised scientists, because the cells they changed began to replace diseased cells. The lifespan of mice doubled, from 7.5 months to 1.5 years. Meanwhile, these mice live for about 2 years. For me, as a doctor and scientist, it is extremely exciting to think that the idea being worked on in the laboratory may bring therapeutic benefits, says Professor Jonathan D. Brown, one of the authors of the potentially groundbreaking achievement. Ultimately, our goal is to develop therapies for humans, but there are still important questions we need to address, he adds. There are still many challenges ahead of the team of scientists. There is still a long way to go from animal research to even clinical trials on humans. Also quite recently, another band presented another promising achievement. Scientists from the Spanish National Center for Cardiovascular Research have shown in an experiment on mice that it may be possible to treat progeria even when the symptoms have already fully developed. They managed to block the production of a harmful, mutant protein in all tissues of mice of different ages. Treatment by as much as 85%. Extended the life of rodents with mild symptoms by less than 7%. With very advanced symptoms, true therapy will require removal of the harmful mutation. We tried to remove symptoms once they developed and determine how long you could wait to start treatment and still see improvement, explains study co-author Dr. Carla Espinos Estevez. According to her and her colleagues, the results may contribute to the development of future therapies used in clinics. These results indicate that strategies specifically targeting the circulatory system could bring significant benefits to patients, improving the quality of life and increasing its length, the specialist adds.